Welcome back to News 2 at 4 o'clock. February is American Heart Month, a time to show yourself some love and take care of your heart. Dr. Garland Green from Baton Rouge General is here to tell us how to do just that. How are you doing?
I'm doing well. How are you?
Good. So let's start off with some symptoms. What people with heart disease who may be at risk, what are they feeling?
Well, you know, the ironic thing is that it's very difficult for me to tell you what any individual is going to feel, but commonly folks will express the feeling or sensation of tightness in their chest, shortness of breath, maybe some nausea, vomiting. Women are a little bit different, and they may often feel arm pain, jaw pain, neck pain, but all of these symptoms are possible. So I always advise folks never to take any lightly or try to self-diagnose because you could be wrong.
I'm curious, does it feel like heartburn or is it worse than heartburn?
Well, I don't know.
You don't know, obviously.
Because that's the
it's different in every person.
It can be different in every person. And to give you an example, I had two women come in yesterday, both with heart attacks. Both said the same thing. I didn't think it was a heart attack. It just felt like just something tight just sitting there, or I just thought it was going to pass. I just called my doctor and asked for an appointment next week. Both were having a heart attack.
At that very moment that they were in your office.
At that very moment.
So it's different for a woman than it is for a man. What are some of the differences?
Well, that exactly is the difference. Is that the biggest difference is women don't have the typical Fred G. Sanford in the middle of your chest pain. Mm-hmm. They more have the shortness of breath and the pains in the other areas. One thing I will say is that the American Heart Association has done a great job in the last few years of trying to educate women on the differences in their symptoms. Thanks to contributors like the Baton Rouge General and other folks who've really put a lot of investment in trying to let women know about these things. Women have often focused on things like breast cancer, which is scary, and it's something that we should pay attention to. But I think it's because it happens earlier, and women have often, even men, see this as my daddy's disease or my grandfather's disease and not my disease. So they haven't really taken care of themselves or prepared for what may come.
So how do people prepare?
Number one, see your doctor regularly every year. It's very important that individuals see their doctors every year because you can't diagnose yourself. You need someone to help you. Also, there are a lot of things that we can do to help prevent these diseases, like controlling your blood pressure, controlling your cholesterol, encouraging you to eat better and to get exercise. And one of the biggest problems we have in our society is the tobacco use.
Right.
We have to curb the tobacco use. Now we'll tell you right now in Louisiana there's a big push to use some of this money that we got from tobacco companies years ago to help folks to help quit. Our group, Cardiovascular Institute of the South, is currently running a program whereby you can come and get tobacco counseling, get medicines, get all these things for free. The only criteria we have is that you began smoking prior to 1988, but it's totally free. So I advise anybody that needs to do that to please do. All
right. Dr. Garland Green, thanks so much for coming in to tell us about keeping our heart healthy. We'll have all this information posted on WBRZ.com soon. You're watching WBRZ News 2 at 4. We'll be right back.